you're recognized for 5 minutes.
Thank you, Madam Chairman, and thank you, Mr. Secretary, for being here this morning. I've got a lot to get through here. Right now, private health insurance in this country is virtually non-existent as the government is currently driving all health care decisions. That is in large part because Democrats have been working for years to move Americans from the small group market to the Obamacare exchanges, even though, according to Congressional Budget Office estimates, Obamacare plans per enrollee are 3 times more expensive for taxpayers than employer-sponsored insurance. In fact, in a reported article in Forbes, December 22nd, 2013, the Obama administration provided special carve-outs for labor unions when they realized the increased cost of provisions like the reinsurance tax. So how is HHS working to help remove barriers of access to employer-sponsored markets for Americans?
Congressman, we work closely with all those stakeholders in the insurance market for health care. We try to complement what's being done by employer health insurance providers. If, for example, on Medicaid redetermination, as some individuals who are currently on Medicaid in your state may end up losing coverage through Medicaid, we work with employer-sponsored insurance companies.
Why wouldn't you give waivers to employee-sponsored plans so that they can go out into the private markets without the assistance of the government? In other words, have a system where we can actually compare cost in the private sector versus this government-run system.
Well, Congressman, remember
why wouldn't you give those waivers? Yes or no?
The marketplace plans that people receive under Obamacare are private sector plans. They are not government-run plans.
No, sir. That's not correct. The private insurers have to, they have to abide by, the providers have to abide by all of the requirements in Obamacare.
Well, of course, you want to have minimum standards.
It's not a private plan.
You do want to have minimum standards.
Do you believe Americans from government-sponsored plans under Obamacare to the private employee-sponsored market would be beneficial? Do you believe we could save money in the federal government if we allowed these folks to go totally private?
We would
these
love
association plans.
We would love to continue to work with anyone who can come up with a lower cost prescription drug plan or any kind of plan for health care overall.
Well, I guarantee you, if you will give them the waivers, they will do it. Mr. Secretary, prescription drug middlemen like pharmacy benefit managers are raking in profits while evading congressional scrutiny. An executive for one of the big PBMs recently told investors to not worry about Congress, that it would find ways to maintain its level of profit if those reforms to things like drug rebates went into effect. Earlier this Congress, I joined my colleague from Georgia, Buddy Carter, who is a pharmacist, in introducing the Drug Price Transparency and Medicaid Act to establish oversight and accountability for PBMs taking part in spread price practices in Medicaid programs that often leads to low reimbursement rates for pharmacies and artificially raises health care costs. What other actions can Congress take to increase oversight and accountability on PBMs?
Congressman, great question, because we know the PBMs should get more scrutiny. We hope that you will engage with your colleagues to change some of the statutory rules, because we think we need to get more transparency in that system. I would agree with you. The PBMs are raking in more money than they should.
Thank you very much. Mr. Secretary, as you're aware, this nation was founded on religious freedom when it was adopted as the First Amendment to the Constitution. That's why the Centers for Medicare and Medicaid Services Framework for Health Equity declares each person CMS serves should receive care that is responsive to their cultural health benefits and practice traditions and other communication needs. In light of that, why did CMS reject an appeal from St. Francis Hospital in Oklahoma, which was threatened with termination from Medicare for having a lit candle behind 2 layers of glass in the hospital chapel?
Congressman, I'm not familiar with that case. I could try to get back
if you'll get back with me on that.
I will.
And how did this threat ensure Medicare beneficiaries are receiving care that is responsive to them?
Congressman, I can try to get back to you, but I would tell you that we do everything we can to protect religious conscience. We have rights in this country. We want to make sure no one is discriminated against. And so if someone believes that they are being discriminated against because of their religious beliefs, we would want to know that, because we would try to protect those rights.
That's interesting, because CMS finally agreed to a compromise, which incidentally coincided with the story hitting the media. So, like, you might better abide by the Constitution before you put out the